Okay, so today's session is of Anatomy MCQ part 4 for the NEET PG 2021. This is the part 4 of it. So let's start with the session. Before starting the session, I would like to give you the brief introduction about the platform. Myself, Dr. Monalisa. I have got an experience of 7 years teaching of various competitive examination. Now, free live sessions and classes on the Unacademy platform. So, for the free live sessions and classes on the Unacademy platform, you can use the code Dr. Lisa-YT or you can use the code ANAT10. So, any of this code can be used by you for unlocking free sessions on the Unacademy platform. So, my dear friends, I would also like to tell you about my free sessions. So, before that, I would like to give you a brief about the schedules of my upcoming sessions. Now, let's crack NEET PG 2021 YouTube session. So, the timing is 7:30 p.m. and I am taking continuously till the 28th of this month, and this is 7:30 p.m. The Let's Crack FMGE 2021 session. This is the session which is taken on the Unacademy platform. Okay, this session will be on the Unacademy platform. So, this is a special class, specially free for you. The timing is 9 p.m. You can join me for this session. Okay, this is on the Unacademy platform. Conceptual anatomy sessions is basically for those students who have time for appearing for the next examination, or those who are in the first year MBBS students. So, those who are first year MBBS students or they have to appear for the next examination 2022 or 23, they can be the part of this session because I am going through this conceptual anatomy starting from the basics, and the above two is the MCQ session. Now, if we talk about the details of this session, so let's crack NEET PG 2021 session. Total 15 sessions I will take for this month, and the timing will be same, that is 7:30 p.m. 7:30 p.m. Okay, so I think I am audible to everyone. Future doctor has arrived. Yeah, I am audible. Yeah. So, and if you talk about the Let's Crack FMGE session 2021, it is again a special session on the Unacademy platform. Unlock code for seeing the session free is ANAT10. 9 p.m. is the timing. Okay. Now, for the conceptual anatomy, I have included the details of the conceptual anatomy special session. So, altogether I have this is the whole detail of my session. As you can see here, this is the whole detail of my session. The date and timing is there, the topic is there, and tomorrow, as it is 18th May, so the topic is histology topic, and that is salivary gland. So, you can have a look of all this topic. Again, I have total of 17 session is there. So, you can be the part of this session. This is on Unacademy platform. Now, the upcoming sessions, I would also like to give you a brief about the upcoming sessions. So, limited time offer is there. So, you can be the part of the sessions of NEET PG Iconic subscription, where the merging of the prep ladder and Unacademy has been done. This will be quite useful for you, and you can use the code again Dr. Lisa-YT. You can use the code Dr. Lisa-YT, or you can use the code ANAT10 for 10% discount. Now, boost your preparation for the NEET PG preparation. Okay, so you can take the subscription. You can take the subscription for this. Okay, so if you take the subscription of 3 months, additional 1 month is absolutely free. Additional 1 month is absolutely free to you. And what about the upcoming session, other one? So let's have a look on these sessions. Okay, so targeting sessions for the MBBS foundation course, professional second year is there coming up. All the great educators of Unacademy platform is taking sessions. The other course is for the professional third year students. Now, target next 22 batch, you can be the part of this session. Okay. And also I want to tell you about the image based session, which will be quite useful for you. And again, any of this session, you can be the part of this session by using my code Dr. Lisa-YT or ANAT10. Okay, 34,000 MCQs are there on the Unacademy platform, my dear students. So 34,000 is not a less amount. Many MCQs are there. They have been you can take the benefit of solving this MCQs, seeing the PDF notes of these MCQs, how to cater this MCQ, how to solve this MCQ. Yeah, Avantika Shahu, welcome to the session, dear. Yes. So about those students who are using the Unacademy platform for the first time. So I would like to tell them, those who are using the Unacademy platform for the first time, download Unacademy app, find your goal NEET PG. Okay, you have to find your goal NEET PG, and thereafter you can take your subscription and you can just be the part of this subscription, any of the subscription which you want, either of 1 month, 3 months, 2 years or 3 years. You can take this subscription by using a code Dr. Lisa -YT for 10% discount. So my dear friends, I think few students has been joined. So can we start the session now of the MCQ sessions? So let's start the session now. So starting with the first MCQ for today's session. This is the first MCQ. So as I told you that I will explain each and every MCQs, but before that I will give you time, okay, a few seconds, so that good evening dear, good evening Kumaran, good evening Avantika, good evening future doctor. So you will get time and you have to solve this MCQ. So 4 options are there. You can write your answer either 1, 2, 3 and 4, because here the options I have written 1, 2, 3 and 4. So whichever feels is the correct answer, you can go for it. So which of the following is true about the anatomy of cerebellum? Which of the following is true about the anatomy of cerebellum? So option 1 is globus cell are present in the roof. Option 2 is vermis is present in the midline. Option 3 is flocconodular lobe is concerned with smoothing and coordination movement. Option 4 is dentate nucleus is the medial most nucleus. So my dear friends, mark your correct answer. Which is the correct answer? 1, 2, 3 or 4. Your time begins now. So yes, I am waiting for answers. Just attempt the MCQ. Anyone? Shrivani Palli has given the answer 4. So which of the following is true? True statement. You have to search for the true statement. So I got one answer 4. Anyone else want to give the answer? So few students have joined. Let me see. Then I will proceed with the explanation. So yes, Kumaran is telling second as the correct answer. Sam B is telling B means second. Okay, I got it, Sam. I got it. I got Avantika Sahu, roll number 10. Avantika Sahu, roll number 10 is giving 2 as the answer. Okay. What about others? Yash Aim Delhi, second as the answer. Yes, yes. Okay. So I got the answers. Can I come up with the explanation of this MCQ? So let's describe the MCQ. Okay. So actually the correct answer here is option 2. Option 2 is the correct answer. Okay. Vermis is present in the midline. I will explain this MCQ. So I would like to explain all the points, whether the correct and the incorrect option which is given here. The first point is globus cells are present in the roof. The other fourth point is dentate nucleus is the medial most. So firstly, let me explain the intracellular nuclei, intracerebellar nuclei, which is made of grey matter, which is lying inside the cerebellar hemisphere. Yes, Shweta is telling 4. So let me explain. So all of you just have a brief of it. Firstly, I would like to explain and then I will show you the diagram also. Okay. Intracerebellar nuclei. So intracerebral nuclei is made of grey matter. It's made of grey matter. How many in number? A total of 4. It's a total of 4 in number. It's total of 4 in number. And it is important that you should know the cerebellar nuclei from lateral to medial. Okay. So these cerebral nuclei from lateral to medial are, write on, from lateral to medial, the cerebellum nuclei are first, second, 3 and 4. So, 4 nuclei, and the most lateral one is dentate nucleus. The most lateral one is dentate nucleus, emboliform nucleus is the next, globose nucleus is next, and the medial most is fastigal nucleus. The medial most is fastigal nucleus. The medial most is fastigal nucleus. So, this is the details of the nucleus which is lying inside the cerebellum hemisphere. So, is it clear? Should I enlarge it? I think it's clear to you. Now, one of the option was about the roof nucleus. My dear friends, among this, dentate nucleus is the lateral most and fastigal nucleus is the roof nucleus. So, it is important. Please note down this point. So, among these options, dentate nucleus is lateral most. It's the lateral most. It's lateral most. Please note down, this is the lateral most. Dentate nucleus is lateral most. And what about fastigal nucleus? So, when we talk about fastigal nucleus, it is the roof nucleus. It is roof nucleus because it is lying close to the roof of, fourth ventricle. Why fastigal nucleus is called as roof nucleus? Because it is lying close to the roof of fourth ventricle. Okay. So, again, let's move on to the MCQ now. So, now I think it is clear to you. Now, that means globous cells are present in the roof is wrong. Why? No, it's not right. Fastigal nucleus is the roof nucleus. Dentate nucleus is medial most is wrong. No, dentate nucleus is lateral most. Now, we are left with 2 and 3. The second point is absolutely correct. Actually, the third point is wrong. So, let us explain that. Now, firstly, I would like to explain the second point. Before that, let me just slightly enlarge this diagram so that you can have a proper view of this. Okay. Now, I would like to show you the intracerebellum nuclei which is located in the white matter. They are made of grey matters and from lateral to medial their location. So, yes, here the most lateral most, which is crumpled back appearance. What you can see here, this is crumpled back. The appearance is crumpled back. Can you see here? This is having a crumpled bag like appearance. This is dentate nucleus, lateral most. Okay. The next nucleus, I will use another color for it, is the emboliform. So, I have just highlighted it in green color. This is the emboliform nucleus. Got it? Moving to the next. The next is globose. This is globose. Okay, this is the globose. What about the medial most, my dear friends? The medial most nucleus is, let me use black color only, this is the fastigal nucleus. This is the fastigal nucleus. So, I think is it clear to you now the location of the nuclei, future doctor? Okay, understood, very nice everyone. No doubt about the nucleus of the cerebellum. Exactly the location from lateral to medial in this diagram, we can appreciate the nucleus location as we move from lateral to medial. The location of cerebellum nuclei. This point is clear. Now, moving to the next point. Now, one more thing I want to explain. Let me just highlight this diagram and let you explain that in cerebellum, like cerebral hemisphere also, cerebellum is having two cerebellum hemisphere, two sides, right and the left. The middle part of this cerebellum hemisphere is united by a narrow median worm-like structure. So, the connecting link between the hemisphere, between the right and the left hemisphere of cerebellum is connected by a midline worm-like structure. What is this worm-like structure called? This worm-like structure is called narrow median structure is called as vermis. Okay. So, this is exactly correct. This is exactly correct. So, if you want to know what is vermis, please write down the details about the vermis. Vermis is narrow median worm-like structure which is connecting two sides, which is forming connection with the two sides of cerebellum hemisphere. Got the point? It is forming a connection between two sides of the cerebellum hemisphere. So this whole area here, this whole area will be the vermal part. This whole area will be the vermal part, the midline structure. This whole area will be the vermal part, and here the other side, which structures which you are visualizing, these all structures will be, these all structures which you are seeing is the hemisphere. This is the lateral aspect. Now, okay, I would like to just give you a brief of cerebellum, then I will come up with the second MCQ, because I want that we should complete the MCQs. There are total of 10 MCQs, but we should complete that topic also. Okay, that is the ultimate goal, that we should complete MCQs, we should complete our preparation for the NEET PG 2021 along with the completion of that small topic. So in brief, I would like to complete. Yes, future doctor, absolutely right. So yes, now in the midline, if you will see, there is 10 parts, okay, 10 lobules, you can say central parts. So the first point, so okay, the first is called lingula. This is one, this is lingula. The second and third, so this is second and this is third, which is called as central lobule, which is called as central lobule and culmen. The fourth and the fifth decleve, as you can see here, folium, vermis, tuber, vermis, pyramid, uvula and nodule. Okay, so no, you can see the parts, naming of the vermal part. Okay, so it is important, if you want to attempt for the INICT examination also, it is important that you have to know the name of the vermal or midline part of the cerebellum. So these are lingula, central lobule, this is lingula, central lobule, culmen, decleve, folium, vermis, tuber, vermis, uvula, pyramid, okay, it's all, and nodule. Okay, this is taken from the Gray's Anatomy. This is the details which is taken from Gray's Anatomy, and the lateral projection of the vermal part is called as, the lateral projection of the vermal part is called as quadrangular lobule, lobulus simplex, semilunar lobule, superior semilunar lobule, inferior semilunar lobule, biventricular tonsil flocculus. Okay, here there is a horizontal fissure. This is the location of horizontal fissure, and horizontal fissure is dividing. This horizontal fissure will divide the cerebellum into, this will be the upper part. So I am highlighting with green color, this will be the superior part of the cerebellum. This whole part is the superior part of the cerebellum, and below this this red color horizontal fissure, below part here, this part which I am highlighting with yellow color, this whole part will be the inferior aspect of the cerebellum, this whole part. Okay, this is, cerebellum is divided into lobes also. There are 3 lobes, anterior lobe, there is anterior lobe, this is posterior or middle lobe or flocconodular lobe. So it is important that you should know the lobes also, and you should know the morphological classification of cerebellum. So I think now this is quite clear that the correct answer is C. From this explanation, now you are knowing that the correct answer is C, no doubt about this. The correct answer is absolutely C. The correct answer is C, no doubt about this. This is known to you because, okay, sorry, the correct answer is B. Now we are coming with the explanation of C. So I want to explain you the point C. So why it is wrong, I will tell you. Actually, flocconodular lobe is not concerned. Flocconodular lobe is not concerned with the smoothing and coordination of movement. It is the neocerebellum part. So vermal is the middle part. This is clear to you. Now come with the morphological classification of cerebellum. So for this, I would like to firstly explain the things in this diagram, and then I will write it also, so that you will have the idea of it. So this is the diagram in which I would like to explain the morphological classification. So let me please highlight this diagram and enlarge it. Okay, this is a plain diagram. Okay. Now just see the morphological classification. Now here actually there is a fissure. The name of that fissure is primary fissure. So this fissure which I am highlighting with green color, see here, this is primary fissure which I am showing you with the green color. I am darkening it so that it will be understandable to you. This is primary fissure, okay. This is primary fissure which is shown in green color. There is also a deep fissure which is called as posterolateral fissure. This fissure which is very deep here, this deep fissure is called as posterolateral fissure. So these primary and posterolateral fissure is dividing cerebellum into 3 lobes, okay. So here this whole part which this whole part which I am showing with pink color, violet pink color, this whole area is anterior lobe. This whole area is anterior lobe, okay, anterior lobe. Then this whole area which is lying below the primary fissure and in between the posterolateral fissure, this is called as posterior lobe. This part is called as posterior lobe. See here, this is called as posterior lobe. This whole area is called as posterior lobe. And the part here and the part of the cerebellum which is lying below this posterolateral fissure which I am showing you with the blue color, this whole area is called flocconodular lobe. So how many lobes we have got? This is flocconodular lobe, this lobe is flocconodular lobe, this is the posterior lobe. Actually posterior lobe is also called as middle lobe. So 3 lobes and I have designated this 3 lobes with 3 color. Is it okay everyone? Are you understanding? Sam, Kumaran, Shrivani Palli, future doctor, Shweta. So in this we are now knowing the lobes very nicely. 3 lobes are there. 3 lobes are there. Now I will use a different color to highlight the morphological classification. So for morphological classification, let me slightly highlight this diagram. Okay. So for morphological classification, there are 3 means cerebellum is divided as a archicerebellum, pilocerebellum and neocerebellum. Okay, neocerebellum is the most developed part of the cerebellum and pilocerebellum is also called as spinal cerebellum, and we have got the archicerebellum. Archicerebellum is the most phylogenetically oldest part of the cerebellum. So archicerebellum is actually lingula. So here archicerebellum, so let me just tell you about archicerebellum. Now we will concentrate about archicerebellum. Archicerebellum is formed by 2 parts. This is lingula, anyone? This is lingula, okay? Lingula, this part is the lingula and this whole part of nodule, okay? This whole which I am highlighting, okay, with red color. So archicerebellum is consist of lingula and nodule, got it? Which I have shown with red color, okay? Lingula and nodule, which I am taking it. Lingula and nodule is archicerebellum, okay? Now rest part of anterior, so if I use black color only, so yes, next part which I am shading it like this just to make you understand, okay? This is which I am shading with the colors with black lines. This is the part of pilocerebellum or spinal cerebellum, okay? And also the part of pyramid and uvula, the vermal part. Which part? Uvula and pyramid. So this part, this is pyramid and this is the uvula, the middle part. So pyramid, uvula and the whole part of the anterior lobe except the lingula. Why not lingula? Because lingula is included in flocconodular lobe. Rest whole area which is rest whole part which is left, rest whole part of cerebellum is called as neocerebellum. Rest whole part of cerebellum is called as neocerebellum. So I think it's okay, I can rub this. Rest whole part except that of the shaded area and the red outlined area which is shown in yellow color is the part of neocerebellum. Is it okay? I will write this thing also that you will not forget. RP, where is this RP cerebellum? Pilocerebellum, pilo, okay, I will write this, okay, that is all morphological classification, okay, it's pilocerebellum, okay, I will write it, don't worry, we will not get confused, all of you, just Kumaran and 360, just write this information, this will be useful for you, okay. So, heading you write down the heading is morphological classification of morphological subdivision of cerebellum. Morphological subdivision of cerebellum. Okay. So, the first is archicerebellum. So, what I have shown you in the diagram archicerebellum, what I have shown you, it is also called as vestibular cerebellum. It is also called as vestibular cerebellum. It is also called as vestibular cerebellum and it is the oldest part of the cerebellum, and just now I have shown you it is consist of which lobe? It is consist of floconodular lobe, it is consist of floconodular lobe and that of lingula. Rahul Madan, sorry ma'am, I left from live class because charging is due to electricity, okay. Rahul Madan, yes, it's okay, don't worry. So, you just charge your mobile and don't worry, this is the first MCQ only because I felt that cerebellum slight descriptive part I will give, don't worry, after that we will have a quick discussion of all other MCQs, 10 MCQs are there. So, what is the role of floconodular lobe? So, what is the, can anybody tell me archicerebellum, what is the action and what is the function? It is concerned with archicerebellum. Sam, first year MBBS student, finding it very helpful in revising the topic. Thank you so much, Sam. Thank you so much. So, first year students, they can join special class of Unacademy also. Mine session is 6 p.m. That is conceptual anatomy. So, just use the code ANAT10 for unlocking free sessions of the Unacademy, and 6 p.m. is mine timing of conceptual anatomy for first year students if you want. Okay, you can revise it. So, concerned with, when we talk about archicerebellum, it is concerned with maintenance, it is concerned with maintenance of equilibrium, tone and posture of trunk, tone and posture. Got it? Not coordination. In the MCQ, the option was given coordination. It is not for coordination. It is concerned with maintenance, equilibrium, tone and posture. So, done with this. Now, moving on to the next one. The second is absolutely right, future doctor, pilocerebellum. So, I think one of the student has asked me only pilocerebellum. So, pilocerebellum means also called as spinal cerebellum. Why? It is connected with the spinal cord. It is consist of, so which lobe it is consist of? It is consist of anterior, it is consist of okay. So, it is consist of pilocerebellum, it is consist of anterior lobe, it is consist of anterior lobe, it is consist of pilocerebellum, it is consist of anterior lobe except lingula, and also it is consist of pyramid and uvula. So which all points? It is consist of anterior lobe except lingula, and it is consist of pyramid and uvula. Absolutely right, Akshit Bhatt, absolutely right. What is the function? It is concerned with which function? It is concerned with which function? It is concerned with tone, posture. It is concerned with tone, posture and crude movements of the limbs. Crude movements of limbs. Yes. Now coming to, before moving on to the second, so third point, neocerebellum. Now my dear friends, neocerebellum is the most developed, neocerebellum is the most developed part of the cerebellum. Absolutely right, Astika, but control limb walking, yeah. It's the most recent part, and rest all part of the cerebellum, rest all part of the cerebellum which is not included in archi and pilocerebellum is consist of neocerebellum, and it is required for coordination of movement. So it is concerned with smooth performance. You can say it is concerned with smooth performance of skillful voluntary movements. So done, everyone. So I think the first MCQ is okay. I have gone much in deeper aspect, much in detail. So we will everyone have understood cerebellum, gross anatomy slightly, neuroanatomy. Yes, Bhatt, absolutely right. So done. Can we move to next MCQ? Question number 2. Okay. Now moving on to the next MCQ. So second MCQ. Okay, second MCQ, zygomycosis, a destructive fungal infection of the sinus, is likely to reach the brain by which of the following route? Whether it is A, cavernous sinus, whether it is external carotid artery, whether it is internal carotid artery, whether it is superior sagittal sinus. So according to you, which is the correct answer? I will give you 30 seconds. Okay, okay, Shweta, yes dear, mark the correct answer. Whichever you think is the correct, mark it right. This is quite common and a devastating condition. Not so common, but devastating condition nowadays. So, yes, what is the answer? A, B, C or D? What is the answer? A, B, C or D? So, yes, I got answers. Akshit Bhatt is telling A, 360 degrees telling A, okay, 360 degree. Yash Ames is telling A, Rahul is telling A, Srivani Palli is telling A, Avantika Shahu is telling A, Kumaran is telling A, okay. Many students are telling A. So, what about me? I also tell it is A. So, the correct answer is A, absolutely right. The correct answer is absolutely right, it's A. Zygomycosis. Actually, can anybody tell me zygomycosis another name which is quite seen nowadays in the COVID patient also, a complication? What is the other name of zygomycosis? Neha Dikshit is telling A, future doctor is telling 1A, yeah. Can anybody tell me, Divoxy Darben is telling A. Can anybody tell me what is the other name of zygomycosis? A fungal infection of the sinuses going into the brain. Mucormycosis, absolutely right. Yes, this is the condition of mucormycosis which is seen in COVID patient after treatment also, and it is quite common in diabetic and the patient who is taking steroid therapy. Neha Dikshit, your classes are very helpful. Thanks for your effort. Thank you so much. It gives me also much बहुत अच्छा लगता है. I feel very good at it. So mucormycosis, the black fungus. Yes, absolutely right. So this is the MCQ targeted on mucormycosis or the black fungus. Zygomycosis, a destructive fungal infection. My dear friends, the infection is firstly seen on the facial areas, in the nose, in the paranasal sinuses, and from here it traverses and reaches the brain area, that is cavernous sinus. So the route is through venous drainage, it's not through the arteries. So very nicely we can rule out two of the option. So that means external carotid artery and internal carotid artery can't be the right answer, because this is not forming the route for the infection to drain into cavernous sinus. Yeah. So yes, all of you are absolutely right, that is black fungus. Actually zygomycosis, I have used this term, I have not used the term black fungus or mucormycosis, because this is the term which was previously used for mucormycosis. Okay. Now yes, and the superior sagittal sinus. Why superior sagittal sinus can't be the right answer? We know that superior sagittal sinus is lying in it's a dural venous channel lying in flux cerebri, and ultimately these all sinus is draining into internal jugular vein. Eyes, severe headache, absolutely right, 360-degree, absolutely right. Yeah. So let me give more explanation. So because of this reason, the correct answer is A, cavernous sinus. So few more points about mucormycosis, like how it reaches the cavernous sinus. So let's move on to that point. Mucormycosis previously was called as zygomycosis. Okay, it was previously known. The infection is caused by, so you will read much more detail in your microbiology class, but just it is a fungal infection. It is caused by mucorales, rhizomucor, mucors, Absidia, Cunninghamilla. So these are all fungals which is causing this infection, black fungus, and these group of fungus are residing on, these group of fungus are living or lives on decaying organic matter, Okay. That means in short, if you don't want to know these all details of this, you can say it is this is a group of Rhizopus species fungus. Now I would like to give you few detail about cavernous sinus. Actually cavernous sinus is lying on either side of the body of sphenoid, and it is a potential route of infection to be reaching from facial areas, from eyeballs, for eye areas and the paranasal sinuses, and ultimately it is reaching into the brain. That route is via cavernous sinus. Okay, so it is a potential route of spread, that is cavernous sinus. So write down cavernous sinus is situated on either side of body of sphenoid bone. And it is a potential route of infections from face, from the eyeball areas and all, it is reaching to the brain via cavernous sinus route, or it's via cerebral veins. Okay, so it is a potential route of spread of infection which is reaching in the brain, cavernous sinus. Okay. Now infection, actually what has been seen that any kind of infection which is lying, infections in case of upper lip, vestibule of nose, nasal areas, vestibule of nose, eyelids, will drain to the angular vein, will drain from angular vein to supraorbital, through supraorbital and supratrochlear veins, and will reach via ophthalmic vein to that of cavernous sinus, CS for cavernous sinus. This is the route. So my dear friends, I would also like to show you a diagram which will show you the communications and will show you the tributaries of cavernous sinus. Okay. So this is one of the route. Now see here this diagram. Okay, this is the diagram. So in this diagram, you can see the tributaries, okay. The tributaries of cavernous sinus is from three sources. One is the orbit, one is the meninges, and the other is the brain, okay. So one source is from orbit, other source is from meninges, the third source is from brain, okay. Okay. So from orbit it reaches via the tributaries of cavernous sinus of the orbit is from. So just it will take another 4-5 minutes and we will cover the topic of cavernous sinus also. It will reach via superior ophthalmic vein, inferior ophthalmic vein, central vein. The tributaries sphenoparietal from meninges, middle meningeal vein, sphenoparietal sinus from brain. Infection tributaries from the brain is superficial middle cerebral vein, inferior cerebral vein. The communication of cavernous sinus, two cavernous sinus on each side you can see, it can communicate with each other by intercavernous connections via facial vein form communication with pterygoid venous plexus via emissary vein passing through foramen ovale and will reach to internal vertebral venous plexus and cavernous sinus. Draining channels are superior and inferior petrosal sinus. So these are all routes of infection to spread. Parveen Sinha. Thank you so much, Parveen Sinha. Thank you so much for your comments. Thank you so much, Parveen. Okay, so yes, we have done this. I would like to show you one more diagram. Okay, so you can see supraorbital vein, infraorbital vein, you can see communicates via superior ophthalmic vein, and we know that superior ophthalmic vein is a tributary of cavernous sinus. It's a tributary of cavernous sinus. So you can see this is reaching to cavernous sinus. This is reaching to cavernous sinus. Other route is via facial vein, deep facial vein form communication with pterygoid venous plexus, then form communication with emissary vein and reaches to cavernous sinus. So these are all routes of infection reaching. You can say infection can reach via superficial middle cerebral vein, superior petrosal sinus, frontal anterior trunk of middle meningeal vein and sphenoparietal sinus. So this is all. So I think the MCQ is clear to you. Can we move on to the next MCQ? All of you are ready for the question number 3 MCQ, third MCQ? Yes. So I think this this route of infection is clear. We have done with the second. Now let's move on to the second MCQ, third MCQ. All the best, students, all the best. Roof of sub-occipital triangle is formed by a direct anatomy MCQ. So I will get more of answers correct. I am accepting many answers which will come absolutely correct. Okay. So yes, roof of sub-occipital triangle is formed by a semispinalis capitis, rectus capitis posterior major, erectus spinae obliquus capitis inferior. Roof of sub-occipital triangle is formed by. So we have got 4 options and you have to mark the correct one. Roof of sub-occipital triangle is formed by. So take your time, mark the correct answer, all of you, whether it is A, B, C or D. So yes, Kumaran S is telling it's A is the correct answer. Kumaran S is telling A as the correct answer. Let me wait for others to answer it right. So yes, I have got Shweta is telling A, Avantika Shahu A, yeah, okay. 360 degrees telling A, okay, 360 degrees telling A, okay. What about others? Rahul A, Rahul is telling A. Yash Ames is telling A, Yash Ames Delhi is telling A. Yeah, I got Tushar Patak is telling A. Okay. So most of the students are telling A as the correct answer, and I think one of the MCQ in the previous 2 session I have explained about sub-occipital triangle, and all of you are absolutely right. The correct answer is semispinalis capitis. Absolutely right. Yes, the correct answer is A, semispinalis capitis. Got it? Yes, absolutely right. Most of you are right. So my dear friends, I think I will just show you this diagram and it will be clear to you, not much going into details of sub-occipital triangle. Is it okay students? Because I think sub-occipital triangle I have already covered with explanation in my previous session. So those students who have missed the session, nothing to worry, they can see this is the 4th session of NEET PG 2021. They can follow 1st, 2nd and 3rd, and there I have explained sub-occipital triangle. Now my dear friends, if you will see this diagram, here you can see the muscle which is dissected out. Here the outline of the muscle which is dissected out, this is the muscle which has been dissected out, and this muscle is semispinalis. Okay, so when you dissect out semispinalis, what you can see, you can reach to this triangular space, and this triangular space which you are seeing, which I am highlighting here, this triangular space which you are seeing is the sub-occipital triangle. This is sub-occipital triangle. This sub-occipital triangle is, for its boundary is, it is formed suprolaterally, it is bounded SL for suprolateral boundary by obliquus capitis superior, rectus capitis posterior major, it is forming its supromedial boundary, and inferiorly it is bounded by obliquus capitis inferior. Obliquus capitis inferior is bounding its inferior border. What lies here? The vertebral arteries, the nerve, okay, the nerve lies here. So we have all run with this contents and all. We have seen the floor, that atlanto-occipital membrane, C1 for cervical vertebra. This all we have done. So I am not going into details of the contents, floor, roof and all. So most of you have marked it also, right? Can we move on to the next MCQ? I am not going in much detail of this topic. If you want, sub-occipital triangle topic is also there on YouTube, which has been taken by me. So yeah, let's move on to the question number 4th. Question number 4th. So just attempt this question number 4th. Which of the following muscle is part of triceps coxae? Easy one. Which of the following muscle is the part of triceps coxae? Which of the following muscle is the part of triceps coxae? Which of the following muscle is a part of triceps coxae? So I am getting answer. Okay, I got. I am waiting for the answers. So yes, Ayushman Patra is telling A. So this is question number 4. Mark the correct answer. So we have got another 6 MCQs. 5-6 MCQs which will be a direct MCQ only. So quickly we will cover up this. So yes, Kumaran is telling C and a question mark, means he is not sure. Okay. Avantaka Sahu is telling B and Rahul B. Okay. So B, C is answers are B and C which is coming up. What about others? Abhimanyu Patil is telling D. Okay, D. Part of the muscle that is triceps coxae. Which of the following is the part of the muscle which is triceps coxae? Okay, so most of you have given the answer and I think I would come with the explanation of this MCQ. The correct answer here is question number 4. The correct answer is B, gemmelli muscle. So we have got 2 gemellus muscle, which is we have got superior gemelli and we have got inferior gemelli muscle together with obturator internus muscles. Actually these 3 muscle we always see together. Okay, obturator internus, superior, inferior gemelli muscle. So I would like to show you the diagram which will make you more clear. So let's see this. Let me just highlight this diagram. So all of you, can you see 3 muscles which is together seen here? So it is called as triceps coxae. So let me just highlight that muscles. So yes, this is obturator internus muscle. This muscle which I am highlighting is the obturator internus muscle, and obturator internus muscle on upper and lower aspect, is having another muscle which is gemellus inferior and gemellus superior. So these three muscle together is called as triceps coxae. These three muscle, that is gemellus superior, obturator internus and gemellus inferior, together these are called as triceps coxae. Okay. So most of you have given the correct answer. Those who have missed out, nothing to worry, just it's a direct MCQ only, just revise this point. So can we move on to the next MCQ, that is MCQ number 5th. Okay, 5th one. Okay, 5th one. Yeah. Sympathetic nerve supply of abdominal esophagus. Okay. Is it T5, T12? Is it vagus? It is T5, T9, T6 and T11. Sympathetic nerve supply of abdominal part of esophagus. I am talking about abdominal part of esophagus. Esophagus has got three parts: cervical, thoracic. I am talking about abdominal part of esophagus. Please mark the correct answer. Hmm. 360 is telling C. Okay, C. Actually, it's slight confusing options hai. I have twisted slight confusing options hai, but I will explain it, which is the correct one. So whichever you feel is right, please mark it. So future doctor is telling it's D. Future doctor is telling it's D. Quite close. Sam is telling D. Sahu is telling D. Shweta is telling C. Yash, Ames, Veena Carla D. Okay, D. Sympathetic nerve supply of abdominal esophagus. So yeah, let me explain this answer. Yeah, I will come up with the explanation. Actually, no doubt about vagus. This is absolutely wrong. No doubt about vagus. It's absolutely wrong, because vagus is parasympathetic. Vagus is parasympathetic. So no doubt about that. Now the option, we have to rule out which option? We have to rule out the option A, C and D. So actually the correct answer is A. But all these things are very close, and in many books it is written T5 and T9 also correct. Okay. In many books it is written T6 and T11 also correct. But if I have to choose one, I will go with T5 and T12. I will take a greater range from T5 to T12 as the correct answer. Okay. So best option will be T5 to T12. Now firstly, let me explain the parts and innervation in detail. So please have a look on the parts of the esophagus. So my dear friends, can you see this diagram? So here let me explain you the part. So here you can see this is the cervical part. Okay, this is the cervical part. The cervical part of esophagus is extending from lower border of, it is extending from lower border of cricoid cartilage. It is extending from lower border of cricoid cartilage to superior border of manubrium sterni. Okay. If we talk about thoracic part, it is extending from manubrium sterni to esophageal opening of diaphragm, And if we talk about abdominal part is extending from esophageal opening of diaphragm It is extending from esophageal opening of diaphragm to cardiac end of stomach, to the cardiac end of stomach. Got it? So these are the three parts, and I have written the extent of the three parts: cervical, thoracic and abdominal. Now in this diagram you can also see the constriction area of the esophagus. So this is shown here, so I am explaining you. So see here, the three constriction areas you can see. One is the junction of pharynx. The first constriction area is the junction of pharynx and esophagus. The second constriction area will be the crossing of arch of aorta. The third constriction area will be at the level of left principal bronchus, and the fourth will be while it passing through the esophageal opening of diaphragm. So these are four constrictions of the esophagus. These are four area of constrictions of the esophagus. Now the question is about the nerve supply. So let me come to the topic now, nerve supply. That was slight confusing MCQ which I have taken, but all was very close. All the four options except one, vagus, all the option was very close. So you have to choose one. Then I would go for T5 to T12. I will take a wider range. Okay. So that is why. So let me give you the details about the nerve supply of various parts. So innervation of cervical part, innervation of cervical part of esophagus. It's by recurrent laryngeal nerve, that is a branch of vagus nerve. It's by cervical sympathetic trunk. So this is the innervation of the first part, that is the cervical part. So in what we can say, when we talk about the cervical part, if we talk about the cervical part, it's from the recurrent laryngeal nerve and vagus, they are parasympathetic. So I would write P for it, parasympathetic, and cervical sympathetic trunk we can write S for it. This is the cervical part. Now coming to the second part, that is the thoracic part. Now thoracic part of the esophagus. So thoracic part of the esophagus is getting sympathetic supply by sympathetic trunk which is running in the neck. So same, it is by the sympathetic trunk running in the neck area only, that is only giving contribution to sympathetic innervation to the thoracic part of esophagus. When we are talking about parasympathetic, P for parasympathetic, it is from the vagus nerve, both vagus nerve. Now coming to the question which has been asked, that is the abdominal part. Abdominal part of esophagus. So abdominal part of esophagus innervation is slightly different from the upper two parts of the esophagus. So it is getting its sympathetic, it is getting its sympathetic innervation. As for sympathetic innervation, it is getting its sympathetic innervation from T5 to T12 thoracic spinal nerves. And when we are talking about parasympathetic, its parasympathetic innervation is from, it is getting parasympathetic innervation from thoracic esophageal nerve plexus, So better, in some books it is written T9 till the level T9 only and T11 only, but best answer is T5 to T12. Got it? So let's move on to the next MCQ, that is MCQ number 6th. Okay, MCQ number 6. Coraco humeral ligament is degenerated part of option A biceps, option A biceps brachii, option B coraco brachialis, option C pectoralis minor, option D latissimus dorsi. So according to you, which is the correct answer? Coraco humeral ligament is degenerated part of. So mark your correct answer. Coraco-humeral ligament is a degenerated part of which of the following muscle? So, I am getting answers are coming up. So, yes, question number 6, answer question number 6, you have to mark the 6th MCQ answer. So, yes, 6, Sam is telling it's C, Sam is telling it's C, okay, waiting for others. So, till now only Sam has given the answer, others, okay, A and a question mark, biceps brachii and a question mark, okay, A and a question mark. Don't worry, I will come up with the explanation. So, yes, Avantika Shahu is telling it's A as the correct answer, okay, let me see, moving with the next. So, yes. Can I come up with the explanation now? It's a direct MCQ. It's a direct MCQ. So, A and question mark. So, Sam has given the right answer and the right answer is C, that is pectoralis minor. Coraco-humeral ligament. I would like to show you the diagram of coraco-humeral ligament, and this is just a factual question. So, you have to know that coraco-humeral ligament is degenerated tendon of pectoralis minor muscle. So, let me show you this diagram. Let me just enlarge. So, here you can see coraco-humeral ligament. This is the coraco-humeral ligament which is connecting the coracoid process, C for the coracoid process, and going towards the greater tubercle of the humerus, greater tubercle of the humerus bone. And this coraco-humeral ligament, the coraco-humeral ligament has been, it's a degenerated part of pectoralis minor muscle. Okay. Now, also what you can see, coracoacromial ligament is shown in the upper aspect which is connecting the acromial and that of coracoid process. Now, glenohumeral ligament is actually, it is supporting and forming an envelope for merging with the fibrous capsule. So, done, this was a direct MCQ. Let's move on to the next MCQ, that is MCQ number 7th. All of you are ready for the 7th MCQ? Okay. So, yes, question number 7th, association fibers are all except, all of the following are association fibers except, all of the following is association fibers except A uncinate, B cingulum, C forceps major and D is longitudinal fasciculus. So, 7th, question number 7th, association fibers are all except. Mark your answers. Question number 7th. So, yes, Shweta, is it your 7th one? C, you are seeing C. Okay, let's others also reply. Association fibers are all except. So, then I will come up with the explanation. So, okay, future doctor A, 360B, okay, nothing to worry, I will come up with the explanation. Actually, the correct answer is forceps major. C option is correct. Forceps major is the correct answer. Association fibers are all except. So I would like to give you the concept of association fibers, commissural fibers and projection fibers. These are brain fibers, okay. So it is important that you have to know the knowledge of these fibers. These are made of white matter, okay, and this is connecting different areas of the brain. So there are three categorization of the fibers. What do you mean by the term association fibers? Okay, the term association fibers means it is connecting different areas of the brain of a single hemisphere. Now our brain has got two parts, one is right cerebral hemisphere and other is left cerebral hemisphere. So when we talk about association fibers, when I am talking about association fibers, it means that these nerve fibers, these white fibers are connecting different area of same cerebral hemisphere. Same cerebral hemisphere means either it is on the right hand side or left part of the brain. So it is intrahemispheric, it is inside that brain, so it is intrahemispheric. When I am using the term commissural fibers, it means it is connecting two areas of the brain. It is connecting right side of the brain with the left side of the brain. So this is an example of commissural fibers. When we are talking about projection fibers, it is connecting brain with the subcortical areas. So let me show you the diagram. This is a schematic diagram just to make you understand. So my dear friends, if you will, okay, so if you will concentrate here, you can see what I am highlighting with the yellow color here. These are commissural fibers, and very commissural fibers example is corpus callosum. This is connecting right side of the brain. This is forming a connection between right and the left side of hemisphere. So these commissural fibers means interhemispheric. It will be interhemispheric. That means these fibers are interhemispheric, crossing one half of the cerebral hemisphere to that of other. What about association fibers? So let me highlight the association fibers now. This is an association fibers which is shown with blue color. These are association fibers. What I told you about association fibers are not crossing. It is lying inside one of that hemisphere only. So these are intrahemispheric. These fibers are intrahemispheric. Now the third group of fibers which is shown here with the pink color, see here. So these are the fibers, okay. So these are called as projection fibers. These category of fibers are called as projection fibers. These fibers are projection fibers, and this is connecting cortical area of brain with that of subcortical area. So they are long fibers, they are long fibers, they are going down as you can see here. So we have got three types of fiber. What were the MCQ asking? The MCQ was asking that all of these are example of association fibers except, my dear friends, coming to the MCQ once again, actually uncinate, cingulum, longitudinal fasciculars, it is two types, superior and inferior longitudinal fascicular. These are all types of association fibers. But when I am talking about forceps major, it is the part of corpus callosum. It's the part of corpus callosum, and corpus callosum is the largest commissural fibers connecting one half of the brain with the other half of the brain. It is connecting right side of cerebral hemisphere with the left side of cerebral hemisphere. I would like to show you, actually when you see the longitudinal fissure which is lying between right and the left cerebral hemisphere from inferior aspect, you can quite nicely see the corpus callosum. Let me show you that diagram. So before that, let me show you few of these fibers. So this is a diagram in which, this is a schematic diagram to show you different types and the name of association fiber. So this is one half of the cerebral hemisphere only, and the different names of these fibers are, can you see here, these are short fibers, these are short association. These are all showing which fibers? Association fibers. Okay, superior longitudinal, cingulum, inferior longitudinal, uncinate. So see here, these are all example of association fibers. They are inside one cerebral hemisphere only. They are intrahemispheric, not interhemispheric. Corpus callosum is an interhemispheric fibers, commissural fibers. So my dear friends, let me just enlarge it. Now this is the brain specimen which is taken which is showing you this brain hemisphere, this brain specimen is showing you the corpus callosum from inferior aspect. These are the fibers of corpus callosum. So these fibers which you are seeing, let me just highlight this. Okay, these fibers, I am talking about these fibers which I am highlighting with this color. These fibers which you are seeing, it is connecting one cerebral hemisphere with that of the other. These fibers. So it is now, I think you are quite sure that these fibers are interhemispheric. Okay, these fibers are interhemispheric, forming, they are crossing. So these are interhemispheric. So these fibers are, these are the fibers of corpus callosum, and these are interhemispheric. These are interhemispheric. These are interhemispheric. Got it? Now I want to explain you about the fibers here. So few fibers of the corpus callosum is going in towards the frontal lobe. These fibers. So the fibers which is going towards the frontal, anterior aspect of the frontal lobe, these fibers are called as forceps minor. These fibers are called as forceps minor. And my dear friends, few fibers from the splenium part of corpus. Actually, corpus callosum has got 4 parts. It is having anterior part. It is having trunk, genu, rostrum, and splenium. So okay, this is the anterior part. Okay, so these fibers are actually it is having parts. It is having rostrum, it is having genu, it is having trunk and splenium. So the fibers from splenium part of corpus callosum which is going, this was asked in the MCQ, which is diverging through the occipital lobe, which is going towards the occipital lobe, these part of corpus callosum is called as forceps major. These fibers are called as forceps major. The part of corpus callosum, the part arising from which part of corpus callosum? That is splenium part of corpus callosum, and going posteriorly towards which lobe of cerebral hemisphere? Occipital lobe of cerebral hemisphere is called as forceps major. Actually, forceps major is producing an indentation into the lateral ventricle also. It is forming. Okay, so we will not go in much detail. I think it is more than enough for you to understand. We will go much detail when I will take the session on ventricles of brain and the brain session. Is it okay? Have you understood the right answer now? Is it okay? You have understood the difference between the fibers and what are the details of forceps major and forceps minor? Yes. So let's move on to the next MCQ. So let's move on to the question number. So we have done with the 7th. Now moving with the question number 8th. Okay, so let's move on question number 8. Which of the following is a wrong statement regarding middle ear cavity? Which of the following statement is wrong statement regarding middle ear cavity? A. Narrowest part is mesotympanum. Middle ear cavity, mesotympanum is the narrowest part. Foot plate of stapes lies in the epitympanum. Head of malleus is the content of epitympanum, and hypotympanum lies below tympanic membrane. So according to you, which is the wrong statement about middle ear cavity? So your time starts now. Please mark the correct answer. Question number 8. Uh, 360 degree. Okay, those who mark your answer, whichever you feel is right, you can mark the answer. So Kumaran is telling B. Foot plate lies in the epitympanum. B as the wrong. Okay, Kumaran is telling B. Question number 8. So yes, Sam is telling A. Narrowest part is mesotympanum is the wrong. So B, future dog B, Srivani Palli B, Okay. So yes, now I think I would come with the explanation of this MCQ. Yeah. So actually the correct answer is, which of the following is a wrong statement regarding middle ear cavity? The wrong statement is, correct answer is B. So those who have given B is right. Food plate of stapes lies in epitympanum. My dear friends, food plate of stapes lies in which part of middle ear cavity? Food plate of stapes lies in which part? It lies in mesotympanum. It lies in mesotympanum. It lies in the mesotympanum part of middle ear cavity. Narrowest part is mesotympanum is absolutely correct statement. Head of malleus lies in epitympanum is absolutely correct. Hypotympanum lies below tympanic membrane is absolutely correct. So first I would like to show you a diagram where you can see the different parts of middle ear cavity. See this diagram. Okay. So see here three parts, actually middle ear cavity. So I would like to shade the tympanic membrane now. So this is tympanic membrane. Let me just shade it. This is which I am highlighting with pink color is the tympanic membrane. What is tympanic membrane? Is the eardrum. Okay. Now and the other cavity which you are seeing. Okay. So the part of the middle ear cavity which is lying above the level of tympanic membrane is called as epitympanum. That part is called as epitympanum. So here let me use on green color for it. This part which is lying above the level of this tympanic membrane, still this level is the epitympanum, which I am showing with green color. This whole part is epitympanum. This whole part is epitympanum. Okay, this whole part is epitympanum, which is lying above the level of middle ear cavity. Now the part which is lying just opposite to tympanic membrane is mesotympanum, and then let me highlight it with another color. I am using blue color for it. This part is the mesotympanum, and the part which is lying, this whole is the mesotympanum part till here. This whole is mesotympanum, no doubt about this, and the part which is lying below this is the hypotympanum, which I am showing with red color. Okay, got it? Now let me just explain it, the important points. This part is epitympanum, which is lying above the level of tympanic membrane. Just corresponding opposite in the middle ear cavity, corresponding tympanic membrane, this whole area which you are seeing is the part of mesotympanum, and the part which is lying below this level is the hypotympanum. So narrowest part is, so if we compare the width, we can see mesotympanum and hypotympanum approximately equal, but mesotympanum is slightly at a level more narrower than hypotympanum. So let's see which structures is located, what all structures. So in epitympanum we are having head of malleus. This is head of malleus. We have incus, which process? Short process of incus. In stape is lying in which part? It is lying in mesotympanum. And long process of incus. Long process of incus is also lying in the middle mesotympanum. So write down. Epitympanum. Nicum contains is the part which is lying above tympanic membrane, is the part which is lying above tympanic membrane, and the structure which is it containing is the head of malleus. It is containing head of malleus. It is containing body and short process of incus. Mesotympanum. Mesotympanicum is the narrow part, is the narrowest part, and it is lying just opposite to the tympanic membrane. It is containing handle of malleus. It is containing handle of malleus. It is containing handle of malleus and long process of incus. Okay. Hypotympanum. Hypotympanicum is the part which is lying below tympanic membrane. Below TM, that is below tympanic membrane. So yes, we have got this. Okay. It's lying below tympanic membrane. Okay. So, actually I wanted 2 more MCQs to be done, but I think I have to start another session right from 9 and before, so I will end here itself. Don't worry, again I will start. Today I have planned 10 MCQs but till now 8 MCQs I have finished. 2 more MCQs are there. I will continue in the tomorrow session. Before that, I just want to tell from 9 p.m. sessions, before ending the session, before ending the session, I would like to tell you once more that 7:30 p.m. is the Let's Crack NEET PG session on YouTube. 9 p.m. session, Anat 10 is the unlock code. Anat 10 is the unlock code, and you can join me for the FMGE special session 9 p.m. So just now I am starting on the Unacademy platform. You can use the code Anat 10 for unlocking free sessions on the Unacademy. And conceptual anatomy session is 6 p.m. session every day, that is on the Unacademy platform. Again, you can use the code Anat 10 for unlocking free sessions on the Unacademy, or taking plus subscription, you can use this code. All the best, keep studying. Thank you so much. Okay, so we will meet tomorrow at the same time. Thank you dear. Can I end the session? I have to start another session on Unacademy platform from 9 p.m. so I am ending the session. Thank you. Okay Kumaran, thank you. So I am just ending the session. Thank you. Yes, thank you dear. We will meet tomorrow. All the best.